everyone, welcome back. This is Mr. Husen Mwasapi. So in this video we're going to be discussing acute lymphoblastic leukemia or lymphoma, the ALL. So before we begin, do not forget to like and subscribe to the channel. Alright, let's get to it. Now, how best can we understand acute lymphoblastic leukemia or lymphoma? So to start with, let us understand that these are hematological malignancies. So by definition, acute lymphoblastic leukemia is a malignant proliferation, which is basically the increase in the number of immature lymphoid precursors, which are called the lymphoblasts, in the bone marrow and blood. Now, in a case when presenting with a mass lesion without significant marrow involvement, it is termed as lymphoblastic lymphoma. Moving forward, we have etiology. Now, etiology is the genesis or cause for such a complication. Now, under etiology, we have the first aspect, which is the environmental triggers. So, in the utero, or say the abdomen, or during pregnancy, genetic mutation occurs, which is the first hit, followed by postnatal infection, being the second hit in children. So, when we talk about postnatal infection, we're talking about, so to say, let's say after delivery, this child or the baby is subjected to infections. So that is the aspect of environmental triggers. Now, under the same etiology, we also have genetic factors. So under the genetic factor, we have what is known as germline mutations, where we have mutation in the, for example, RUNX1 and the PAX5. Sometimes sounds like PS5. So the PAX5, yeah, under certain conditions like the Down syndrome or Fanconi anemia. Now, other than the mentioned two, we also have a rare kind of etiology, which is the second acute lymphoblastic leukemia or lymphoma. Now, this is very rare, and it arises after chemotherapy or prior malignancies. Now, what am I trying to say under this second acute lymphoblastic leukemia or lymphoma? Now, in this case, this means that if an individual had different malignancies prior to this ALL, acute lymphoblastic leukemia, it basically means that they had a particular problem back then, and now they are subjected to this malignancy due to the previous one. Yeah. Look at the clinical features. Clinical features. Now, this just implies that when a person visits a health facility, what do they present with? Those are the clinical features we're trying to look at. Now, you need to take note that it's important that pediatric dominance is about like 80% of childhood leukemias, and the peak incidence, or rather at the time this problem arises in terms of different populations, is at the age of 2 to 5 years. So, what I'm trying to say is that the symptoms that the person having this acute lymphoblastic leukemia presents with are the following symptoms. The first one is a fever, fatigue, bone pain, bleeding, mediastinal mass. When you look at mediastinal mass, we're just looking at the mass that presents on the sternum or breastplate, which can cause things like dyspnea, which is just difficulty in breathing. And we also have hepatosplenomegaly, which just implies that there's an enlargement in the liver or spleen. So these are basically what a patient with this condition presents with at a healthcare facility. All right, let's move on. Now let us look at the morphological features. Let us start with the lymphoblasts. Now the lymphoblasts, which you earlier mentioned, to start with, they are heterogeneous in size, which means they have different sizes, and they also have what we call a high nuclear cytoplasmic ratio. Now, in terms of high nuclear cytoplasmic ratio, what we're trying to say is that if we look at the basic structure of a cell, you would find that the nucleus has grown in size in comparison to the cytoplasm ratio. Other than that, we also have the second aspect, which is immunophenotyping. Now this is where we have the different parts, or the different types rather, where we have B, acute lymphoblastic leukemia, where we would find the CD19 plus, the CD10 plus, and in most cases 95% pediatric cases. Then we also have the T, acute lymphoblastic leukemia, where we have the CD3 plus, and in this case that's why we find the mediastinal mass being common. Then we also have the cytogenetics, where we have two conditions. It could be favorable, poor. And in a favorable case, we have hyperdiploidy. And in a poor case, we have the KMT2A requirements. Yeah, and this is basically what we need to know about the morphological features of this particular condition. So, under complications, we have the first aspect which is basically tumor lysis syndrome, where we look at hyperuricemia, renal failure, which is basically after chemotherapy initiation. Then we also have the central nervous system involvement, where we have the headache and cranial nerve palsies. Now, what do we mean when we talk about cranial nerve palsies? Let's look at an event whereby, let me give you a practical scenario. Let's say from writing a certain paper, and you're furious about the argument you're having with your colleagues, and one of them decides to tell you something that is contrary to what you had written. Out of impulse, you decide to initiate the step of slapping your friend. Now, since your hand is supplied with nerves, if at all there's a particular, if at all the nerve that allows you to move your hand or fingers is having a problem, or there's a problem with those particular nerves, that's why we have the cranial nerve palsies, where you are unable to move your hand or fingers due to maybe a damage or an issue with the nerves that control such. So this is mostly comes from the cranium, which is just basically us looking at the head region. Then we have infections, where we look at neutropenia related sepsis. This is where maybe we look at infections such as pneumocystic pneumonia. Yeah, that is basically everything about the complications. Alright, moving forward, let's look at the prognosis, which just depicts the outcome of a particular disease. So in children, there is a 90% 5-year survival with intense regimens, that's like a lot of treatments. Then for adults, there is 40% survival. It's just worse with age that is greater than 60 due to high white blood cell count, which is mostly due to infections. Yeah, basically infections. When there is a count that is greater than 100,000 per microliters of the white blood cells. So under prognosis, this is literally the aspect. Then to conclude, let us look at prevention. Unfortunately, there isn't any known prevention, though early diagnosis via blood smear for unexplained cytopenia can actually work. So this is basically what you need to know about everything concerning, not really everything, but the important aspect of acute lymphoblastic leukemia or lymphoma. We have looked at every aspect, which is the definition, etiology, clinical features, morphological features, complications, prognosis, and lastly the preventions. Alright, thanks for your time, thanks for watching. Don't forget to like and subscribe, and remember, slow progress is better than no progress, and let's strategize before you become a statistic. Let's try and push for that A+.